I really enjoyed both Matthew's and Awais and obviously John's presentations before me. And I will be shifting gears a little bit in some regard, because I think what I'm about to say is going to be complementary to their emphasis on education and philosophy of psychiatry at the graduate level or at the medical school level. Because I'm currently the director of our Medical Humanities program, which is a super exciting new program at the University of San Antonio, Texas San Antonio. And we have about 457 majors at the undergraduate level at this point. There's tremendous interest. And I will tie some of those things that we are doing in our program to the larger goals of education in mental health. So I will talk a little bit, kind of introduce medical humanities and mental health education, which will not be unfamiliar to the audience, I'm sure. And I will also kind of try to kind of talk about our conception of medical humanities and medical humanities education in the 21st century, especially the need to shift from talking about doctors or making doctors humanists to making healthcare professionals at large humanists. So kind of broadening our pool of target audience a little bit. And then I will kind of showcase some of the examples of this vision of mental health education through our medical humanities program. So when I think about medical humanities, of course, one of the first people that comes to my mind is Pellegrino, Edmund Pellegrino. He was one of the founders of Medical Humanities Initiative. And in the kind of, in the early days of medical humanities insights, there was a lot of focus on medicine having been extremely kind of moved in the direction of technicality, over specialization, over professionalization, and maybe even more business-like, and the attempt to kind of remedy that, bring the humanism back into the medicine through an education in medical humanities. So, these are kind of direct quotes from Pellegrino's famous article, Educating the Humanist Physician, an Ancient Ideal Reconsidered, where he argues for the need to prevent science and business to take the soul out of medicine, and educating and the route to do this, to be able to achieve this goal, is educating physicians in the humanities as a kind of key to revive the humane and morally centered medicine. I love teaching this article in both my introduction to medical humanities seminars and in my more advanced courses, even in philosophy of psychiatry, as a way to kind of think about these largest humanist related issues in kind of medical education and medicine at large. So when I think about the 21st century medical humanities program, I see a little bit of shift. So first of all, at least in the context of the United States, the way to medicine is no longer just the way to be a physician or doctor. Increasingly, doctors and physicians have to rely on a very hardworking, solid network of healthcare professionals. And I think the pandemic showcased how we need a very good kind of team of healthcare professionals working together to address a lot of the issues in the direct medical and clinical context. So I would like to think of the 21st century medical humanities programs as aiming not just to educate future doctors or future physicians, but also in kind of instilling these ideas of humanism early on when students are studying going to nursing school, physician assistant programs, medical aid, and a variety of other healthcare disciplines, even including pharmacy. Another shift that I am seeing, and I would like to see perhaps as a philosopher of science, is to kind of replace this conversation of juxtaposing science versus humanism in medicine as if they're opposing goals. I think good science is humanist science, and good humanities engagement is only possible with a respect and true understanding of science. So in this sense, in our medical humanities program, in the way that we build curriculum, we see the scientific and medical disciplines complementing humanistics and humanities disciplines with the goal of making medical field at large as more humanistic. And I think to be able to do that, to perhaps going back to Matthew's points earlier about democratization of the curriculum, I think there's a lot of resources that we can draw on to make medical humanities more kind of integrating scientific and humanistic disciplines by thinking about kind of philosophy of psychiatry as an example, or philosophy of science, philosophy of medicine, narrative medicine, feminist philosophy. There has been a fantastic turn, I think, in the last 10 years within the philosophical landscape to kind of increase these cross-fertilizations between issues about humanities and social justice and so on the one hand, and science, medicine, etc. on the other hand. So in that sense, our medical humanities program, which is an undergraduate education program, is geared towards training future healthcare practitioners who are more prepared to address the complexity of mental health. And this requires not just understanding of the science of mental health, which, as we all know, is complex in itself, but also humanistic dimensions of selfhood and mental health at large. So the goal is to start them young. So by the time, hopefully, they will come to your medical school or your psychiatry residence programs, they will already have had some background training and understanding of philosophy of psychiatry and philosophy of mental health that directly deals with scientific and humanistic issues in mental health. So now let me tell you a little bit more specifics about our program. So the Medical Humanities program is an undergraduate program that is housed in the Philosophy and Classics department at the University of Texas in San Antonio, where I'm currently an associate professor, and I recently became the director of the program. So UTSA is located in San Antonio, which is about 3 hours north of the border of Mexico. And we have a very high population of Hispanic students. In fact, we are designated as Hispanic serving institutions. So in that sense, we do have an extremely diverse student body. So you can actually see the kind of statistic here. We have 57% of our student body are Hispanic, 21% white, and we also have a good representation from different ethnic and racial backgrounds. We also have majority female students. And also, very importantly, as you can imagine, being very close to the southern border, we also have a lot of students who are part of the Deferred Action for Childhood Arrival program, which is also known as Dreamers. And we have a lot of educational programs within UTSA and the Medical Humanities program to kind of address the needs of these diverse group of students. In our Medical Humanities undergraduate program, we have 3 different concentrations, and this takes me back to how I started, where a lot of our students definitely want to be doctors. They want to go to medical school, and when you ask them, as you can imagine, the enthusiastic undergraduate student is because they want to help. It's because their family had a lot of health issues growing up, and they want to now go back and give back to the medical community, or they have faced some injustices in the medical context, and now they want to go and fix the field. So it's very actually aspiring and inspiring to see them. But we also have a lot of students who are interested in other medical areas, and they want to be nurses, they want to be physician assistants, they want to be physical therapists, they want to be genetic counselors. So there's a wide variety of interest in other health careers as well. We also have students who want to be speech language pathologists who can follow the pre-advanced practice provider concentration. And depending on these concentrations are requirements for the natural sciences, medical humanities, social and behavioral science, and art and humanities required and elective courses change. So one of the things that really kind of moves me and helps me get up early in the morning every day to start thinking about the program and my work is to think about how the kind of diversity of students that we have at UTSA will all be kind of trickling down to different areas in medicine and hopefully making medicine a more humanistic space, whether it's in the context of psychiatry or family medicine or in nursing and what have you. So just kind of, so we have a number of electives and required courses. And from the philosophy department, we offer a number of required seminars and classes for students to take. And I just want to focus on one example of a medical humanities seminar that I teach, which I think is closest to a philosophy of psychiatry course that we could imagine. I bring a lot of conversations and debates from philosophy of medicine, feminist philosophy of science, and philosophy of psychiatry into our curriculum and content in the medical humanities seminar. And also, of course, given my work on the value of first-person experiences in psychiatry, we also read a lot of first-person accounts. And these courses, these seminars have been really, really engaging. So, and over the years, I covered a variety of topics. So for instance, the historical conversations about the origins of medical humanities and Saz's early work about psychiatry and mental illness has always been a hit. We think and talk a lot about grief because a lot of students can directly relate to the experience of grief. And starting with like animal and human grief, we think about historical conceptualizations of grief in Freud's work, and more recent conversations about the bereavement exclusion criteria in the DSM-5 and the several debates that have led to that change has led to between Wakefield and other philosophers. We also have a lot of we also spend a lot of time on intersectionality and feminist philosophy of science as they relate to the issues of philosophy of medicine. So here we read Ankeny, Bloom, Crenshaw, Miriam Solomon, and kind of talk about the various intersections of mental health and health at large with issues about gender and diversity in general. And especially this unit has been really I think moving and inspiring for our undergraduates, and I will exemplify some of those kind of projects that kind of we started as a result. And also we do some kind of more hardcore philosophy of science. We read Ian Hacking. We think about social constructionism versus realism conversations when it comes to mental health. And then we spend a lot of time thinking about how to categorize and classify mental disorders and looking at the history of the evolution of the DSM and so on. So these courses, these seminars have been a big hit in our program. And initially I was concerned, well, is this a lot of mental health and mental disorder, not enough maybe general areas of medicine? But those concerns have been kind of have disappeared over time, because a lot of my students also have scribing experiences or practical experience in medical context. So they were able to actually bring a lot of their firsthand experiences in a hospital into our conversations when we were talking about mental health. And that's actually when I started thinking about this. I'm like, okay, actually an emergency doctor or an emergency nurse also needs to understand mental health issues, because they are in the front lines confronting with those issues all the time. So some of the kind of, of course, the content, for students' grasp of the content is important to me, but I care a lot about their kind of the skills that they gain in these seminars and the medical humanities curriculum at large, especially given the kind of underserved nature of a lot of our students. When they first start college, we work on their reading skills, writing skills, and so on and so forth, that skills that they will need in any kind of career that they will choose. So one thing that I started doing in my seminar is, because I know they're highly motivated to get into medical schools or other healthcare professional programs, is to, we work together on their personal statement in the class, and they have to do a certain number of they have to use a certain number of articles and readings that we've done in the class. They have to reflect on themselves and think about why do they want to be a nurse and why they want to be a doctor, and then kind of they incorporate all of these into a personal statement, and we form groups. Everybody gives each other feedback, and it's been a really kind of fantastic assignment for students, because they feel like, oh, actually I'm getting to write my personal statement while in the class, and in the background they're also learning a lot of these themes that I try to teach in the medical humanities seminar. I had a lot of students who are basically.
Dr. Tekin?
Yes.
Sorry, you have about a minute left.
Yes, I'm almost done.
Great.
One of my students got the best undergraduate research paper award because she wrote a paper on what does it mean to be a good patient. We always talk about being good doctors, but what does it mean to be a good patient? A lot of my students did these projects that involved what do we need for to educate college students on mental health. We had students who talked about the particular challenges of being undocumented students and what kind of mental health effects that experience has, and they've done projects on those. Several of them had gone to international conferences and did presentations, and a lot of them have gotten into various like medical schools or healthcare professional schools, but also have gotten into programs in genetic counseling and so on. So the best is yet to come in terms of what we are doing with the Medical Humanities program as it relates to mental health education. Our new dean, Dr. Martinez, who could not be here today, he specializes in language policies in health delivery system, especially in Spanish-speaking communities in the U.S. along the U.S.-Mexico border. And we are very keen on developing different kind of certification programs in medical Spanish and so on and so forth. We have a Medical Humanities lecture series. If you follow me or the UTSA Medical Humanities page on Twitter, you will be able to see those announcements. And we will actually have Dr. Aftab giving a talk for us in April. And these lectures, these lectures are fully online and all is welcome. And thank you.